The thyroid, a small butterfly-shaped gland in your neck, plays a big role. It produces hormones that impact energy, metabolism, and more. When your thyroid isn't working correctly, it can lead to various health problems. That's where thyroid tests come in. These tests help doctors understand how your thyroid is functioning and diagnose any potential issues. Thyroid tests typically involve a simple blood draw. They measure levels of thyroid hormones and related substances in your bloodstream. These tests can also detect antibodies that attack the thyroid gland, signaling an autoimmune disorder. In addition to blood tests, imaging tests provide a visual representation of the thyroid gland, helping to identify any structural abnormalities. Understanding the results of your thyroid tests is crucial for effective management of any thyroid conditions you may have. By working closely with your healthcare provider, you can receive appropriate treatment and support to maintain your thyroid health. Several key blood tests help evaluate thyroid function. One of the most common is TSH, or thyroid stimulating hormone. TSH is produced in the pituitary gland and signals the thyroid to produce hormones. A high TSH level can indicate an underactive thyroid, hyperthyroidism, while a low TSH often signals an overactive thyroid, hyperthyroidism. FT4 and FT3 measure the levels of free thyroxine, T4, and free triiodothyronine, T3, in your blood. These are the active forms of thyroid hormones that your body uses. High FT4 and FT3 levels suggest hyperthyroidism, while low levels are seen in hyperthyroidism. Antibody tests, such as anti-TPO and anti-TG, detect antibodies that attack the thyroid gland. TRAB, or TSH receptor antibody, is another antibody test used to diagnose Graves' disease, an autoimmune disorder that causes hyperthyroidism. These blood tests are essential for understanding your thyroid function and guiding treatment decisions. Imaging tests provide valuable information about the size, shape, and structure of your thyroid gland. A thyroid ultrasound uses sound waves to create images of the thyroid, detecting nodules, goiters, enlargement of the gland, and other abnormalities. Scintigraphy, also known as a thyroid scan, involves swallowing a small amount of radioactive iodine. The iodine is absorbed by the thyroid gland, and a special camera captures images of the gland's activity. This test helps identify areas of overactivity or underactivity within the thyroid. If a suspicious nodule is found during an ultrasound or scintigraphy, a fine needle aspiration, FNA biopsy, may be recommended. This procedure involves using a thin needle to extract cells from the nodule for examination under a microscope. Thyroid tests provide a comprehensive assessment of thyroid function and health. By combining the results of blood tests, imaging studies, and clinical evaluation, healthcare providers can accurately diagnose and manage various thyroid disorders. For example, a high TSH level combined with low FT4 and FT3 levels suggests primary hypothyroidism. On the other hand, low TSH with high FT4 and FT3 levels is indicative of hyperthyroidism. Positive antibody tests, such as anti-TPO or anti-TG, in conjunction with abnormal thyroid hormone levels, may point towards Hashimoto's thyroiditis, an autoimmune form of hypothyroidism or Graves' disease. Understanding the purpose and significance of each test empowers individuals to take an active role in their thyroid health journey. Regular monitoring and timely diagnosis are crucial for effective management of thyroid conditions and overall well-being.